Bloating. When you have bloating, your stomach feels uncomfortable and full. It's extremely typical, and you can take steps to make it easier. However, if you get frequent or persistent bloating, consult a doctor. What causes bloating? Having a significant amount of gas within your stomach is the most typical cause of bloating. Various foods and beverages, including certain vegetables and carbonated drinks, as well as swallowing air while eating, can contribute to this. It may also be brought on by a digestive issue, such as constipation, a food sensitivity, celiac illness, inflammatory bowel disease, IBS. In around time of their menstruation, some people experience bloating. Bloating that persists might occasionally be an indication of a more serious condition, like ovarian cancer. The signs of bloating. You might get swollen if your stomach feels larger than normal or full, you experience discomfort or stomach pain, or your stomach is grumbling or grunting, or more frequently than usual, you fart. How to prevent bloating? Exercise frequently to enhance digestion and lessen bloating. It can also be beneficial when you already feel bloated. Avoid swallowing air by chewing with your mouth closed. Drink lots of water. Consume fiber-rich foods if you're constipated. Consume lighter, more frequent meals as opposed to big ones. Rub your stomach in a right-to-left motion to release suffocated wind. Avoid consuming a lot of carbonated beverages, alcohol, or coffee and tea's caffeine. Avoid eating a lot of foods like cabbage, beans, or lentils, which are believed to cause flatulence. Avoid eating heavy meals before bedtime or while slouching. Eat fewer processed, sweet, spicy, and fatty foods. If you are sensitive to a certain food, avoid eating it. A pharmacist can aid with bloating relief. Asking a pharmacist about constipation can be treated with laxatives. Medications to reduce the bloating, such as Buscopan. Locate a drugstore. Unimportant advice. See a doctor if you've felt bloated for at least 3 weeks. Routinely experience bloating, more than 12 times a month. You've tried altering your diet, yet you continue to feel bloated. You have a bulge or enlargement in your stomach. You have bloating in addition to being ill, having diarrhea, being constipated, losing weight, or having blood in your poop. Because you're bloated, it's tough for you to walk about or perform daily tasks. Act immediately if you see any of these symptoms. Go to A&E, or dial 999 if you're experiencing a severe or abrupt stomach ache. When you touch your stomach, it hurts. You're throwing up blood or coffee ground like vomit. Your poop is dark or crimson. You are unable to urinate, defecate, or fart. No air can be breathed. Your chest hurts. Locate the local A&E clinic. What we understand by extreme suffering. Bloating treatment. Often, there is no need for treatment for bloating. Your need for treatment will depend on the underlying cause. GPs may recommend you to an NHS dietitian if typical dietary advice, such as avoiding foods that make you bloated, is ineffective. Send you to a doctor so they can order some testing to determine what might be causing your bloating. Enjoyed the video? Please like and subscribe.